right. This is the first workshop. That's right. This isn't the busy one, is it?
No.
We have a packed house. This is great. Excellent, excellent. All right, does everyone have a green sheet with a little clipboard? Everyone? All right, and everyone have a pen? If you need, you can write notes on it, stuff like that, or write down questions that you have that you can ask whenever, but you can remember to ask, which is great. All right, so we're gonna get started. How about that? So, yeah, I like to keep it really informal. So I've told a lot of you, but if you have any questions, raise your hand, ask them. Just throw stuff at me, not the clipboard. I'll duck. But yeah, so it's pretty informal and light. So who here has had back pain in the last 30 days? Yeah, a couple people. All right. Yeah, just a couple. So can I ask for a volunteer just to kind of talk about what kind of symptoms they've been having? Does anyone care to share? Yes, sir. Your name?
Ken.
All right, Ken. Thank you.
I was helping my daughter do a yard sale at their house, and was carrying boxes up and downstairs, and now I have severe lower back issues. I see a PT, in fact, in a few days. But,
and how long has that been going on for?
well, I've had back problems most of my life, but this particular thing, about 5 weeks now.
5 weeks? Okay. And is it right in the lower back? Does it go down the legs?
It's lower left.
Okay.
Right by the hip, where the hip and the back muscles come together.
Okay.
I've had x-rays and they say the hip is fine, but the lower back is where the problem.
Yeah, and that can kind of be tricky sometimes, whether it's coming from the hip or lower back. And when are your symptoms the worst? Like, what causes symptoms?
Well, sitting here right now, I'm feeling it.
Okay.
Like not be funny, but
Yeah.
Sitting, driving, when I get out, it takes 2 or 3 steps to
Okay.
get everything in motion.
Yeah. And it's not uncommon that sitting causes some back pain. So obviously a lot of you raised your hands that you have back pain today or have had back pain. So if you need to stand up, move around, by all means do that, okay? Thank you very much. Anyone else? One more, come on. All right.
Hi, my name is Danny.
Danny, great name.
Thank you. Want to sing for you? Hi, Danny boy. Yes, I have back pain. I've had back pain most of my life, and I had my sciatic nerve taken out. What was what?
You had a discectomy.
Okay.
There you go.
Yeah.
And
What she said.
I still have a lot of back pain. And
Okay.
My back pain consists almost every day. If I'm standing a long period of time on this floor or cement or something, my back pain gets a lot bigger and worse down my legs. And then my legs start bothering me and everything.
Okay.
And I'm sitting here like this gentleman, I have back pain just sitting here.
Okay.
If I do any expensive work, it bothers me bending over.
All right, so some disc issues, standing up for long periods of time and doing work or things around the house, probably yard work or whatever it might be. Okay. All right. All right, so definitely I feel like, some of you can relate to some of those stories. And only, of all the people that spoke, I think, there's only 3 gentlemen in here? And 2 out of them, and none of the ladies. I can't believe it. Yes.
I'll tell you my story. My name is Chris, and I never had back pain really in my life until about, I had one episode years ago, but this summer I really started having trouble with driving.
Okay.
When I sit and drive, I really get a big pain from like the middle of my hip all the way down to my toes. And it's very uncomfortable, and I feel like I'm quite active. I walk a lot and, do yard work and all those things. So I'm much more comfortable when I'm up and walking and doing things, but as soon as I sit down, then, I've got this.
Then you get the pain.
Yeah.
Okay. Have you done anything for it?
Well, I do a lot of stretching exercises,
Okay,
and it has helped somewhat in taking some ibuprofen.
okay, all right.
Oh, and it's also, I had a knee replacement on that leg. So,
Ah.
you know, it's, that's, the whole right side is uncomfortable.
Causing some issues. Okay. All right, so we are gonna jump right into it, okay? And like I said, if you have any questions, let me know. But we're gonna start on the top of the list of your little green sheet there. Then we're gonna work our way down. I used to make you fill in the blanks as we go along, but I've gotten nicer over the years. And I've given you the answers. It's an open book test, but so that you can just jot down notes or have any questions, okay? So, all right, can everyone see this okay? Okay, all right. So, what is sciatica? So, you know, here in Dover, Somersworth, we have a lot of patients come in, and you know, they say, you know, I've got the sciatica, or I have sciatica, and you know, what is that? So, the sciatic is a nerve, okay, and it's actually the largest nerve in the body, and it actually starts in the lower back, and so it starts right up here in the lower back. Here's the spine. Just to orient you, so this is, that figure right here is looking that way, so this is the back. And it comes right from the spine here, and it's the largest nerve that comes down from the lower back and actually splits into two nerves right around the knee and goes all the way down the leg and into the foot, okay? It's actually, so sometimes when people come in and they say, hey, you know what, I've got this pain down in my knee or down in my calf, and they talk about, you know, when this all started, and I start to say, you know what, I don't think it's your calf, or I don't think it's your foot even, and I'll start to look up at the back first, and they look at me really weird, but this is exactly why, because you can have a problem in your back and feel it all the way to your foot, okay? And sciatic symptoms can cause numbness, they can cause tingling, they can cause pain, okay, or any three, okay? They can also create some weakness, or almost like a heaviness in the leg. Does anyone feel like they've ever had heaviness in the leg, or like it's difficult going up and down the stairs or getting out of the car? Yeah? So that, a lot of it is from the sciatic nerve, as well as it could be possibly the sacroiliac joint, which we'll talk a little bit more about later on, okay? All right, so just to back up real quickly, so I am from Somersworth Physical Therapy, and I'm a doctor of physical therapy. I'm the owner of Somersworth Physical Therapy, and so just how I got into lower back and specialized into the lower back and sciatica, just a real quick background. So I grew up in Londonderry, New Hampshire. Does anyone know where Londonderry is? Yeah, just south of
Born and
me.
raised.
Nice, I like it.
A long time ago.
All right. My parents actually just moved there from there, and they moved up to Manchester, but they were dentists in town, from Lombardy. So, born and raised in Londonderry, and I went to UNH for undergraduate school. So I was talking to someone about Epping, who just moved from Epping recently, a couple years ago. I was in Epping for a couple years when I was going to UNH, and then I moved to Portsmouth. And then I did my Doctor of Physical Therapy degree over at Franklin Pierce University, which is out in Ringe, but it's actually the only PT school in New Hampshire, and it's actually, right now, it's in Manchester. So it was in Concord at the time, and now it's in Manchester, but it's the only PT school in New Hampshire. So when I was going through PT school, it was, I had just finished up, it was December, and just finishing up graduate school. I was married at the time, and my wife was expecting our second child. So our first child, who is now 10, Thomas, you know, she had really no big issues with the pregnancy, but Lily, who's our daughter, she was pregnant with, gave her a lot of trouble. She had a lot of back pain with when she was pregnant with Lily. So it was Christmas time. I have a big Italian family, and so Christmas Eve, we usually go to my parents' house for a big Italian feast. And so I'll never forget it, we were there and having dinner, we're all sitting at the dinner table. My wife goes over to the oven just to get a, I think it was like lasagna or eggplant parmesan, something like that, get out of the oven. And so she bends down, grabs it, and like stands up and it's like that. And just like gives me these big eyes, like she's all locked up. Has anyone done anything like that? And then you stand up and you can't move. So that was her. And so she gives me these eyes and she couldn't walk. She's like, I can't move, what do I do? So I'm like, this is my time to shine. I'm in front of my whole family, you know, just about to graduate from PT school, and I'm gonna be like this big hero and show my family what I've been doing, you know, my degree. So I'm like, all right, I help her up into the other room, and I say, let's go over to the other room and I'll help you. And they I'm gonna go through all these exercises that I was taught. So we go in the other room, have her do these exercises, and you know, I was able to get her so that she could stand up and walk around a little bit, but she still had a lot of pain. And I was thinking, like, there still needs to be more, okay? And what they teach you in PT school is not enough to really get at the root of a lot of these problems. It was so bad that on Christmas Eve, when we went home around 9:30, we had to look around for a pharmacy that was open so that we could buy a cane, okay? And she's like, this is pathetic. You know, I'm like 30 years old, I have a cane, and I can't walk around. And she's like, looks at me and she goes, you're the physical therapist, you have to fix it. And so I'm thinking to myself, wow, this is gonna be a long marriage. No. So, happy wife is a happy life, I've learned. And so I've always had a passion for the spine. And so over the past 8 years of practice, I've really dedicated our practice, not just because of her, well, I'll tell her that, but I really love the spine. So I've dedicated the last 8 years of my practice to learning more about the joints and specializing in how it all works. We've learned from a lot of therapists and some of the big researchers, who is Dr. James Dunning. He did a lot of his research over in England, across the pond. He's got this really nice accents. And then also Dr. Josh Cleland, who's actually local here in Concord, who are kind of like the gurus in all the spine therapy. And so before, when we were practicing, it was, you know, we do a little massage, maybe some of that ultrasound or a heat pack, and say, you know what, hey, that's all maybe give you a couple exercises, and you know, that's all we know how to do. Now, there's been a lot more research in evidence-based practice, okay, to get our patients better and quicker, okay, and more long-term, okay, so it doesn't just rebound and you have these issues again. So that's where our research-based treatments have really come along. And why they've started in Europe is because Europe is has a government-funded healthcare, okay? So if you went to if you're in Europe, okay, and you say, hey, you know, my back really hurts, they're gonna say, you know what, step in line. We'll see you in, you know, 4 or 5 months, because that's when the next appointment's available. Or you could go to a different physical therapist and pay cash, okay, and say, hey, you know what, I'm gonna pay cash for my treatment or therapy. But obviously, if you're paying cash like $100 a visit, you want results, right? And that's why a lot of the research has started there, because they want to get you better quicker and faster. And we've adopted a lot of that research to incorporate into our practice, okay? So that's my big, long explanation of how I got into specializing in the lower back. So we've been in practice for about 6.5 years. We started off right on 108, down by Pinewood Medical Facility, okay? And we recently just moved, September 1st, to a new building, which is right in Salmon Falls Family Healthcare, or right where the Works is. Does everyone know where the Works is? It's kind of like a landmark throughout. But as you pull into the Works, we're the first building on the right. Salmon Falls Family Healthcare is there, and we are there. Okay, so we've just opened up a really nice facility there. And over the past 6.5 years, we've had over 40,000 patient treatments. So we've got to work with a lot of patients, okay? About 70 to 80% of our patient caseload is spine. So we see a lot of backs, all right? Over the past 6.5 years, we've come up, I've had patients asking me the same questions over and over and over again, and asking all these questions. So I'm saying, hey, I should put this all into a report. So I actually put together a report called the Top 10 Most Burning Questions for Sciatica, okay? Which just gives a little explanation of you know, what is sciatica, how does it happen, you know, what is physical therapy, what would it do for my sciatica? And later on, if you do want a copy of that, I can get your information and I will send it to you, okay? And over the past 6.5 years, we wouldn't be able to do any of this without an amazing, amazing staff. So just to go over, there's Lisa, our office manager, okay? She's like the #1 right there, okay? This is Dr. Justin. Dr. Justin came to us from UMass Lowell and has specialized in the lower back as well. We've actually all taken the same courses through Dr. James Dunning, so we all treat the same way, which is really nice in a practice, so that if a patient can't get on my schedule, they're able to go to Dr. Justin, Dr. Laurel, and Dr. Jen, and everyone's treating the same way, and we have all the same philosophy on how we treat the spine, okay? Lisa, who is our office manager and keeps us all together. This is Vanami. Vanami is from University of Connecticut, and she's a physical therapist assistant, okay? And she does all the same mobilizations and treatments. Really the only thing she doesn't do are the evaluations, okay? This is Alicia, and she is our patient coordinator. So she helps patients get set up and all the intake aspects. And this is Dr. Laurel right here. She worked at Brigham and Women's Hospital on the surgical floor, and she works with a lot of orthopedic cases, and she actually still does per diem on the weekends, go down there. But she graduated from Ithaca College up in New York. And we have one new addition, Dr. Jen, who's from the University of Vermont, okay? So we all treat the same way, which is really, really nice. All right, so in your head, we're gonna do a little exercise, okay? In your head, in the past 30 days, think of the most amount of pain that you've had, okay? So 0 being no pain, 10 being going to the emergency room. Think of that number, okay? And when you had that pain, what were you doing, okay? So just shout out a couple times what people were doing that caused the most amount of pain. I've heard sitting or driving was a couple of them.
Getting out of bed.
Getting out of bed, so in the mornings are really difficult.
Vacuuming.
Vacuuming, that is
Changing the bed.
changing the bed. Yes, I remember talking about vacuuming is never fun, but yes, it's even worse when you have a bad back.
Just
Okay.
standing.
Just standing. Who said that?
Stairs.
Okay.
Stairs.
Stairs. Okay.
Laying in bed.
Laying in bed too. Yeah. All of the above, yes. C, all of the above. So some of the most common things that I hear, which it sounds like we've really hit on a lot here, you know, walking, running, stairs, first things in the morning, standing, yard work. Luckily, most of the leaves should be down by now, but yard work is always a real big one. Gardening in the summer or in the springtime is really difficult. Housework, just vacuuming, all these simple tasks that you need to do on a daily basis, and it makes it even worse when you have a bad back. So, as doctors of physical therapy, we have patients. We have patients come in right to us. Okay, most insurances don't need a referral, so they come right to us because we're doctors of physical therapy. And a lot of times, when I see a patient come in, I'm going to have them do certain movements. Okay, which we'll do in a second, actually, all as a group. So certain movements. Okay, to see if we can replicate the pain or cause the pain. Okay, it sounds really mean. It sounds really mean, but we're not mean. Because if we can reproduce the pain, okay, then we know a lot of times what's causing the pain, and then we know that the pain is reducible. Does that make sense? So with all of our evidence-based research and evidence-based treatment, we know we have special tests that we do. So we know that if certain movements are causing or replicating your symptoms, then it might be stenosis. Or we know if these couple tests are causing some of your symptoms, it maybe is a lumbar disc or a herniated disc aspect, okay? And again, for the sacroiliac joint, which we're going to talk about all 3 of those, okay? Or degenerative disc disease, okay? So that's really important. And what they've actually found is that they can take x-rays. Everyone can have an x-ray here, okay? Or an MRI. So you can have an x-ray or MRI. And we could hold them up here, and they've actually done tests where orthopedic surgeons, they could not say, hey, these are your symptoms, so this is your MRI. This is your MRI because these are your symptoms. because everyone's symptoms are different depending on your MRI, okay? So my MRI could look awful, or my x-ray could look like my back is a mess, but I'm able to do everything without pain. Vice versa, you could have an MRI or x-ray that looked okay, but you have a lot of pain, okay? So that's why they've gone away from doing a lot of x-rays and MRIs in the early parts of your treatment, because they find that it's not gonna help out any afterwards. So really, our treatments aren't based on our MRIs or x-rays. All right. So these are just some other issues, I just had pictures, but what I wanna do is, I wanna do a little exercise. So, we're gonna put our clipboards down on the ground, and I want everyone to stand up. We're gonna do 15 jumping jacks. No, I'm just joking. So, alright, nice and easily, we're all gonna do this together and in unison so that we don't hit anyone, okay? So, all I want you to do is kind of hands down by your side and just go to your tolerance, okay? I'm not asking you to go all the way to the ground or anything. But nice and easy, I just want you to bend down, okay? As far as you can comfortably. Everyone go down, and then you're gonna come back up. Excellent. Did anyone have pain with that, or was that difficult for anybody? A little difficult? Okay, a couple people. Now what I'm gonna have you do, you're gonna put your hands on your hips, and we're gonna go backwards. Nice and easy, okay? This might be a little bit more difficult, and then come back up. Did anybody have discomfort or pain with that? Usually a few more hands go up on this one. Okay. Now what I want you to do, this is the one we gotta do all together. Yes?
Are you asking if they're pain when you're doing the motion, or when I feel the pain when I come up and stop, both going back?
So that
and
would
going
still
forward?
be a positive.
Okay.
Okay, so yes.
Okay.
So did it change anything? And sometimes I ask that for people and they say, you know what, when I lean back, my pain goes away. So that's also, it's not always causing pain, sometimes it can take away the pain. So this one, we're all gonna go this way. But what I want you to do is you're gonna go down to the side, okay? So go down that way, and then come back up. And now let's go to the other side. Go down, and come back up. Now did anyone have pain doing either of those? Okay, did anyone have pain more on one side than the other?
Yes.
Okay, yep, all right, excellent, job well done. Good job, all right, now you can sit back down. And it wakes us all up, right? So those are some of the, just a real basic tests that we do to determine what's causing the pain. So now what I want to do is I would love to have a volunteer. Would you volunteer? You want a volunteer to come up? For,
I will if I need to.
come on up. So real quick volunteer
He's looking at me.
to come on up. Let's give her a round of applause. Come on. All right, and watch the cord here. We'll come right around this way. And your name again? I failed. Pat. All right, Pat.
Hey, Pat.
Yes, I failed on my test of all, remembering everyone's name.
Yes.
I
was just
know.
thinking.
So what kind of symptoms have you been having, Pat?
Well, I have the degenerative disease of the lower lumbar.
Lumbar?
Lumbar.
And where is your pain? More on this left side right there?
Here.
Okay.
Yeah,
Not in the center, but just off to the side a little bit?
yeah.
Okay. Yeah, so that's that little dimple, like right on where that dimple is. That's a lot of times where people will say that's where their pain is. And what causes your pain? What kind of things?
Oh, everything, walking, standing for a long time.
Okay, all right. Have you
Brain
had any,
pain, I gave up on everything.
and you said back pain as well, right,
Oh,
earlier?
it's awful.
Okay.
And I'll have the pain the next day.
Okay.
Something fierce, yeah.
Have you done anything for it? Or do you take
Well,
any
I have-
medications, or what do you do?
I had been to the orthopedic and they sent me for some physical
Physical therapy.
therapy,
Okay,
which was right next to, I don't know what the name is anymore.
Marshbrook right there. Yep,
Marsh,
yep.
yeah. I did that for about 6 months.
Any relief, or?
I didn't feel that much, no.
Okay.
I think because it was during Christmas, and if I was walking a lot and doing a lot of shopping,
Mhm.
I was a mess.
Okay. So what I want to do is nice and easily, I'm going to have you just stand right there. We're just going to do the same test going forward, backward, side to side. All right. So what I want you to do is lean forward as far as you can comfortably. All right. And then come back up. Any pain with that?
No.
Okay, that's good. Hands on your hips. And I want you to lean backwards. And then come back up. Any discomfort with that?
Yeah,
Okay, how would you rate that? 0 being no pain and 10 being going to the emergency room.
probably like a 5.
A 5? Okay. Now put our hands down by the side. And let's go down to the left.
Yeah, that's when the left is
That's when you feel that
sensitive,
pain.
yeah.
Okay. And how would you rate that pain?
But right now, I haven't been doing a lot of stuff at home, so I guess it's not as bad.
Okay.
As if I had been working outside, it might be worse. But
Okay.
it's about like a 5, I
Okay.
would say.
And let's go down to the right. A little easier.
Oh, yeah.
Okay, you got it. All right, so what I want you to do, I'm gonna put your glasses right over here. It's gonna be not too bad, okay? I want you to, can you lay right on your back here? All right.
Oh, this is nice.
All right, see? That's all you have to do.
This is nice.
All right. So I just want to do 1 or 2 tests, okay? I just want to see something. And it'll go on your left side, you said, correct? Okay. So I'm just going to bring this leg up. Just like that. And let's cross this leg. Is that okay there?
It's okay.
Do you feel that a little bit?
Yeah, oh, yeah.
Okay. You got it. Just going to do a little push here. Is that okay?
Yeah, but
Okay.
it's not bad.
You got it. So what I want you to do, can you roll onto your left side? Excellent. And can you scoot all the way towards me just a little bit more? Scoot this way just a little bit. There we go. I'm going to put one hand right here, okay? I should have brought a pillow, sorry. And I'm going to have you bend your knees, okay? So what I'm going to do is just move it back just a little bit. Really lightly, not going to hurt at all, okay?
Okay.
All right, so this is kind of just some of the things that we do, and this is some of the mobilizations that we do that we've kind of learned from our research that helps with that lower back. And you said you had some degenerative disc disease, right, in the lower
Yes, I
back?
have X-rays and,
Okay, yep, and you've had x-rays, exactly.
yep.
No pain with this, right?
No, I don't.
All right, I get to do all the work, see? I'm gonna go up a little bit here, and now I'm gonna go back down. And most of the pain's on your left side, correct?
Correct.
Okay. All right, excellent. And now what I'm gonna have you do, you're just gonna lift your legs up like this. Hold it right there, don't let me move it, okay?
Yep.
Hold it right there, hold it, hold it, hold it, hold it. Excellent. And now what I want you to do is push down to my hands. Push, push.
Yeah, that's
That you feel a little bit on your left side?
right.
Okay, we're gonna do that one more time. Hold it right there. Don't let me move it. I'm gonna push down, so hold it. And now push down. Push down right to the table.
Yeah, when I push down.
That's when you feel it. Okay. That tells me a little bit more information, so that's okay. Now what I'm gonna have you do is you're gonna roll onto your right side. And I apologize, now you get to see the bad side here of me, you know? And you're gonna scoot all the way to this side again, do the same thing, just to this side now, okay? We'll put your hand right under there. Excellent. We'll bend both knees. And so what this is doing is helping move some of the spine and some of the joints, okay? All right, so we're going to do this again, just like this. Pretty easy, right?
Yeah, that's not bad.
All right. Just
That's
a little.
more sensitive.
That's a little bit more sensitive. Okay, then we're going to go down like this. All right.
Actually relieves the pain.
So that's helping?
Yeah.
Okay. That's good. Now we're going to lift these legs up like this. Hold it right there. Don't let me move it, okay? Hold it, hold it, hold it.
Yeah.
Okay. And now you're going to push down. Push down to my hands here.
So that side is not.
That's okay. So relax. How long have you had these this back pain?
I went, it got so bad that, I think it was 2014,
2014?
That's when it seems to be a little better.
Okay. Hold it right there for a second. Don't let me move it. Hold it right there. Good job. And now push down on my hands again.
Yeah, that bothers.
Okay. And now I'm going to have you go onto your back again, okay? So you can roll right onto your back. Good job. So you've had this for a few years, many years. Okay.
Yeah, and it seems, I was doing exercise regularly.
Yeah.
And I do the yoga, but it seems to have been a little bit less, you know, I find the pain when I work too much or do something.
Okay. And now what I want you to do is you're going to squeeze your legs together.
Yeah, that's
A
kind
little
of
bit
hard
right
on
there.
my left side. Yeah.
And now let's push out. So you're going to push your legs out. A little easier. We'll do that one more time. Push together. And you're going to push out.
That one's difficult.
That
on
one's
this
difficult.
side.
Okay. Let me have you sit right up, and I can help you if you need to. And we're going to stand up, okay? All right.
Probably dizzy.
All right. Doing okay?
Yes.
Okay. So let's come right over here again. And we're going to do those same movements, okay? So you can face everyone here. So turn right around. All right, so going forward, you were fine, right?
Yep.
Going back, you had about a 5 out of 10 pain. So what I want you to do, put your hands on your hips, and I want you to lean backwards.
You're gonna catch me.
Yeah, I'm not letting you go anywhere. That's actually better movement.
That's about it.
Okay, come back up. Any discomfort with that?
Yes,
How would you rate it?
like about a 4 or 3.
Okay, so a little
I
less?
couldn't- Yeah.
Okay. And let me have you put your hands down by your side now. And going to the left, you were having difficulties, right?
Right,
So let's go down to the left again.
yeah.
Good job.
about
Come
here.
back up. Is that better, worse, or the same?
It's about the same.
Okay, but a little bit better going backwards.
Right.
Okay, excellent. All right, let's give her a round of applause. Good job. See, I told you it wasn't that bad. There are your glasses. I'm gonna have you go that way, just for the cords, okay? Thank you very much for volunteering. So, right? So, just an overview of what happened. That is just some of the quick mobilizations that we do to the back. And even after having pain for many years, that we were able to reduce some of the pain leaning backwards. And that was just, 5 or 6 minutes of doing some of the quick treatment. But we really focus on some of that hands-on treatment, okay? And that's really the big difference, okay? So we're gonna get right back to the worksheet, okay? This is what I want everyone to be doing. Who's this gentleman on a skateboard, right? I love that picture. So, the number one biggest mistake that people with lower back pain and sciatica make, okay, is they ignore it, okay? I don't know how many times I hear patients will say, oh, well, it'll go away eventually, or, you know what, I'm just getting older and so I've got to have back pain, right? Or, my parents or my mother, they always blame it on the mother for some reason. My mother had back pain, so that means I'm going to have back pain or arthritis, right? Or sometimes they'll say, well, I work on hard floors, so I'm going to have back pain, or I do a lot of hard work, or I've done a lot of labor in when I was working. But what do those kind of sound like? Those kind of sound like excuses, right? And really not doing anything about it is the worst thing. So, number 2, so the second biggest mistake that people make is they start to alter it. And altering it looks like they start taking medications for it, okay? And so they might say, you know what, I did a lot of yard work yesterday, so I'm going to have to take some Advil this morning because it's going to be really stiff. And then, a week or 2 later, like, you know what, I'm going to take Advil again because it's really hurting. And then they start, a month later, they're like, I'm taking Advil every morning because I have pain in the morning. So I'm just going to, I wake up, I get out of bed, and I put my Aleve or Advil in. Or sometimes you go to the doctor and they give you some pain medication, so you start taking pain medication. And you can see how that cycle moves on. Sometimes you'll be taking some, or go to the doctor and they'll give you injections, okay? And that's kind of just altering the pain. Or even surgeries, okay? But it's not really you're not really treating the root of the problem, and that's the big thing. It's like if we have the fire alarm goes off in this room, all right, it makes this big loud noise, all right, that's really annoying. We're gonna put our hands over our ears, but it's less noisy. But have we really done anything to do anything for the cause of the problem? No, it's less noisy right now, but we don't know if there's a fire down in the gym or a fire, up in the lobby. So we're not really doing anything to treat the problem, right? So that's a really big thing. And then next is when they handle it. And that's usually when we get involved and patients are saying, you know what, enough is enough, I'm sick of taking medications, or I'm sick of altering my movements, or you know what, I used to walk every day and now I'm not able to walk. Or a big thing the other day was, a woman was telling me, you know what, I just want to go out and be able to shop with my friends and not feel like I'm holding them up, because every 10 minutes I have to sit down and I feel like a burden to them. And so that was her big thing, is she wants to just go walk with her girlfriends in the mall, especially with the holidays coming up. And she had stopped doing that, and she shied away from going out with her friends because she couldn't walk as long. So usually when people come to the grips of, hey, you know what, enough is enough, I want to handle it. And that's when we come get involved. And we see a patient, and we do these special tests, okay, and see what's going on, and we dive right into the root of the problem, okay? Now we're going to talk about the causes of lower back pain. So the number one common cause of lower back pain is a disc herniation, okay? So just a real quick thing of anatomy. So this is the lower back if you were looking at me this way, and you can see just my spine, okay? So what are these? Vertebrae, excellent. In between each vertebrae? Nice. Disc, that is perfect. And these little things coming out? Nerves. So at every level, we have a vertebrae, disc, and then you have a nerve coming out of each level. This is looking straight down on a disc, and this is called the annulus fibrosus. Okay, real fancy term. You'll never have to remember that, so don't worry. It won't be on the test. And then the nucleus pulpus right here. What I basically say, it's like a jelly donut. Okay, so you have the donut with the jelly inside. If you squish the jelly donut, the jelly's going to push out and push into the nerve, and that's a herniated disc. Okay, really painful. So a herniated disc usually, okay, but not all the time, 35 years or younger. Usually it's caused from a lifting injury. Okay, they'll have really point-specific pain down the leg. So you know, sometimes people are like, I kind of have some pain down the leg. This one, someone could trace it with your finger and say, hey, I have pain here, and it goes all the way down here. Maybe it wraps around the leg and into my big toe. They can really point it with like a pen, and they can draw exactly where it is. And usually, you'll have increased pain bending forward, because as you see, if I bend forward, it pushes that jelly donut out into the nerve, and that will cause more pain, okay? And this is one where actually leaning back, someone will say, hey, you know what? This makes it feel better. And so it reduces some of the symptoms. Next is, this one might be a good one here. So number 2 is arthritis, stenosis, or DDD, which is degenerative disc disease, okay? We've heard of DDD as well, but anyone else heard of degenerative disc disease, stenosis, okay, and arthritis? So who here on their next birthday cake is going to have over 50 candles? All right, you don't have to go any further than that. So, if you're older than, if you have more than 50 candles on your next birthday cake, if you have pain with standing and walking, and the pain goes away when you sit, or is alleviated when you sit, and you live in America, okay, they did a study with all these categories. If you can check off all 4 of those, you have a 95% chance that you have arthritis, stenosis, and degenerative disc disease. Okay, a 95% chance.
What is stenosis?
Great question. So stenosis. So here's the spine. Okay, and I'm going to be looking this way now. All right. So the spine is just like this. These are vertebrae, right? Here are the discs. The nerves coming out. Okay. So stenosis is right here. There's a little hole, this little canal that the nerve comes out. as that can start to close down. And if that closes down, that is called stenosis, okay? And that will start to pinch the nerve and create pain in the back and going down the leg, okay? So that's stenosis. So that's why people that have arthritis, stenosis, or degenerative disc disease, as you're walking, you're kind of standing up and closing down that little hole a little bit. So you're gonna, as you're walking, you're gonna say, hey, you know what, that's creating a lot of pain. And your body says, hey, if I sit down, that's kind of like leaning forward, it opens up that hole, right? And I have less pain when I sit. Or who has seen, if you go to like Walmart or Market Basket, you know, someone that might kind of lean on the cart a little bit, okay? Yeah, so what your body is telling you is, hey, if I stand straight up, it's closing down those holes, and I have a lot of pain when I do that. So if I just lean just a little bit forward and hold on to this cart, it's going to open up those holes a little bit and create less pain, right? So that's your body telling you that. Also for degenerative disc disease, who here is taller now than when they were 18? So I used to be 6'5" when I was 18, and now look at me. I'll be like this tall when I'm 80. No. So what happens is, the disc height is about this high, okay? So here's the disc. As we age, it starts to dehydrate, okay? So as the disc dehydrates, it gets a little smaller. And we're just talking about a couple millimeters per disc. But if you can see all the disc closing down a little bit, A, that's why you're a little shorter now than when you were when you're 18. But also, you can see that that closes down the hole as well. So there's less height here, so that's going to create some stenosis here. Patients that have degenerative disc disease usually have stiffness in the morning. So you wake up in the morning and you're really stiff. And then it takes maybe 15, 20 minutes, a half hour to kind of warm up, and then you're feeling a little bit better. What happens at night is our discs rehydrate, okay? So they kind of fill up a little bit, but the muscles get really tight, okay? So when we're sleeping, it rehydrates, the muscles get really tight, and then your body wakes up and goes, oh, I'm really stiff, or I need to take a nice warm shower to loosen up, or go in the hot tub to loosen up, and then I feel better. So that's your body's own way of loosening up those muscles. But really what needs to be done is we loosen up the muscles around the back. So these muscles right down in here, we loosen those up so that you can kind of keep that disc height for longer periods of time. So it doesn't happen every single morning, okay? Does that make sense? Any questions at all? All right. And we recently had a, I'll talk about him after. So this is Donna here. Donna had degenerative disc disease, okay, and came in recently and had a lot of pain in her lower back, pain in the morning, and actually went down the leg a little bit. And after about 2 months of treatment, we were actually able to get her back up and walking, no pain and pain-free, which was really, really nice, okay. This is my buddy Skip. All right, so anyone for the number, like the biggest mistake that people make with lower back pain and they ignore it or say that I'm just getting older, okay? Skip here is 88, and actually just saw him when I was doing a talk about 2 weeks ago. Skip is 88. He came in for lower back pain and actually knee pain. We did some evaluative work and found out that a lot of his knee pain was caused from his lower back. He again was dealing a lot with stenosis. And after about 3 months of treatment, because he had these symptoms, I want to say, for about 15 years, mostly on his right side. He is now able to walk 3 miles every day, and he does it every day with his dog, Sophie. He wrote a book about the dog, Sophie. He also wrote a book about himself, The Legacy of Skip. If you ever see it, he does a lot of book signings. He might have even come here at one point. But he walks 3 miles every day, even in the winter. He walks back and forth on floor 1, then he goes down the stairs, doesn't use the elevator, walks back and forth on floor 2, and then on floor 3. Every day until he hits 3 miles, wears his little pedometer. He's amazing. He does a word puzzle every morning, and that's how he says he stays sharp. And I believe it. I can only wish that I'm that agile at even 80, let alone 88. So age is just a number, okay? And I tell people that all the time. So, number 3, which is a really tricky one, okay? The SI joint or pelvis problems, or sacroiliac joint, okay? So, if we think of the spine, okay, so this is me looking that way. If we look at the spine as like building blocks, okay, and we have blocks, okay, which block is the most important? The bottom one, right? The base, okay? So if the base of the block is off just a little bit, obviously the top one, they're all gonna fall, right? Same exact thing with the sacroiliac joint and pelvis issues. So just a little anatomy. Here's the sacrum. So that's kind of like your tailbone right there. And this is kind of your pelvis, or your hip joint. So this right back in here. The sacroiliac joint is that little dimple on each side, okay? So whenever someone kind of points like, hey, I've got issues right over here to the side of the back, or just a little bit off to the center, or maybe to this side, that's when I'm starting to think about the sacroiliac joint. The really tough part about the sacroiliac joint is we've had patients from 14 years old to 95 years old, okay? So it doesn't fit into one, age group or category. It doesn't show up on x-rays or MRIs, because you can have just a really small shift in that sacroiliac joint, and it's going to cause a lot of back pain, okay? It'll cause back pain. It'll cause hip pain, so sometimes people will think that they have hip arthritis, when in actuality it's coming from the back. And sometimes it can create this vague pain down the leg, or even groin pain from this sacroiliac joint, okay? And so it's really, really difficult because of that. You can't see it on x-ray or MRI. This is, to go back up once, let me back up one moment. So the other issue with the SI joint issues, a lot of times after patients have had even surgery, whether it be a fusion or discectomy or stenosis issues, and let's say it doesn't solve the issue, a lot of times I start to look at this SI, or people have said, hey, I've had physical therapy before, but it didn't work. A lot of times they're not looking at the correct area. And that's why this is really difficult, because if the base of the blocks are shifted a little bit, of course you're going to have an issue up here, right? So you might have some stenosis up here, or some disc issues up here, but the real root of the problem is down here, okay? And we see a lot of that with people that have had fusions or other surgeries to the back. A lot of the problems are actually, the root is down here. So this is Kim. Kim came to actually one of the first lower back workshops that we did at our clinic. And Kim used to be an avid runner, mountain biker, and was really, really active. She had gone through and had chiropractic work, acupuncture, injections, she was on pain medications and muscle relaxers, and she kind of came to our workshop kind of as that last straw, and she did some treatment. We actually found through our test that we ran that it was coming from her SI joint, okay? And this is Dr. Justin here. Dr. Justin was able to get her back to running, biking, and things that she hadn't done in over 5 or 6 years because of treating the true cause of the problem. So at our clinic we have a big graduation wall with a lot of these patient stories, which is really fun to read and go through and kind of see where patients have been and where they are now because of treating the correct issue. So just to review, the 3 common causes of lower back pain and sciatica. The first one is that herniated disc. That's usually 35 years or younger, a lifting injury, and it's really specific pain, where you can point right down the leg on where it is, and it hurts more when you're bending forward. The arthritis, degenerative disc disease, and stenosis. That is, if you have pain walking, 5-10 minutes of walking and you have increased pain, but it is reduced when you sit. Or when you're walking in the grocery store and you kind of find that you need to lean a little bit on that cart, okay, to open up those holes in the lower back. Or have 50 or more candles on your next birthday. And then the SI joint, or the sacroiliac joint, pelvis problems. And that's the really tricky one, and probably the one that we treat the most, because if patients have had other treatment in different areas, or whether it's other physical therapy clinics or the orthopedics, and they're still not getting any results, that's usually the one that we find is the true root of the problem or the true issue. And that's where you're having pain just off to the side. A lot of times you'll have pain going down to the side because that compresses that SI joint. And sometimes you can have vague hip pain on the side or hip pain in the front or a little bit of leg pain, okay? So it's really kind of vague pain, but it is still really painful. All right. One last quick story. So this is Frank. And Frank is showing his muscles here. Frank came to us. He has had 2 spinal fusions, okay? He had a spinal cord stimulator. Has anyone heard of a spinal cord stimulator? So basically it's this little electronic device that they implant at the spinal cord so that it causes less pain. It basically it just tingles so that all you feel is tingling and not the pain, but it doesn't really stop the pain. He was on opiates or pain medications and having injections and still didn't have any relief. He came and saw both Justin and myself, Dr. Justin and myself, and Manami, and we were able to get him back to playing golf. He's a big avid fisherman. He lives over in Wells now. He moved recently, but he is just amazed at the things that he's able to do. And his biggest thing, or big takeaway was, you know, he loved the beach, and they would get on to Florida every so often. He's like, you know, I just want to go and take a walk on the beach with my wife and not be afraid that we make it all the way down the beach and then I can't make it back because of my back pain. And so his big thing when he came back for his 2-month follow-up was like, I was able to go walk down the beach and back, and he was almost in tears. Like that was his big thing that he wanted to do, just walk down the beach with his wife. So we got to be able to do much more golfing and fishing and everything, but it was really, that's like why we got into PT, for stories like that and to help people like that. And everyone's goals are different. Some people want to get back to running. Some people just want to be able to cook a meal and not have back pain, okay? Or be able to put the sheets on their bed and not have back pain. But some people want to get to higher level activities, or golf. Golf is a big one as well. So how do we do it? We talked a little bit about the hands-on treatment. So we take this European style of physical therapy, or manual hands-on physical therapy, to treat the problem. Sometimes it's through mobilizations, which we saw today, okay? Sometimes it's a little traction where we open up, and we kind of pull on the legs a little bit to help open up some of those disc space, okay? We do some core exercises as well to help stabilize everything. So once we realign the spine or open it up a little bit, we want to make it stronger in that position so that you have good carryover and that you're able to go long term without any pain and without treatment eventually. Okay, that's our goal. So here's some stabilization treatments. Here is some mobilizations. And then everyone always looks at this one and says, what is going on? So this is called dry needling. And dry needling, it's not acupuncture, but we use the same needles. Okay, so we use the same utensil, but in a different fashion. And this has been a real groundbreaker, and I think it helped us get to where Frank was today, okay, in golfing and walking on the beach. So we're all certified in dry needling. We take these small acupuncture needles and go right into the muscle tissue, so it might be towards the lower back. And this has been found to reduce the sensitivity in that area and help loosen up those muscles. Because just like we talked about in stenosis or degenerative disc disease, if those muscles tighten up and are kind of compressing the disc a little bit, if we can loosen those deep muscles up that are around the spine, just a couple millimeters or centimeters, it'll allow that disc height to get a little bigger. It'll allow the holes on the side where the nerves are coming out to open up a little bit so that you don't have to lean on the cart, or you can walk for a half hour to an hour without feeling like you have to sit down because the pain is so bad. So this has been a real groundbreaker in some of the physical therapy treatments that we do, okay? All right, I do have a couple other happy graduations. This is Cheryl here. Cheryl was over at Liberty Mutual, used to work over there, and she actually came in with a walker and couldn't walk from the parking lot to her office, okay? And after treatment, we were actually able to get her walking with no assistive device. She didn't have a cane, walker, anything. I should have taken this picture with like her walker like on her shoulder as she was walking out, because that's how well she did. And this is Jen, who had a lifting injury, a herniated disc actually from work. And through myself and Manami, we were able to get all the pain away from her leg. She had pain all the way down into her foot. Able to eliminate that pain and get her back to work 100%, which that was her goal. Okay. All right. So, who feels like they got their money's worth today? All right. So,
Does Medicare pay this?
yeah, so Medicare does pay for physical therapy, and because we're doctors of physical therapy, all you need is, if you have a primary care physician that you go to, we would see the patient, okay, and we would do the evaluation, and we send that evaluation over to your primary care physician, and just to notify them that you're being seen, they sign it and then they send it back. So Medicare does cover this, okay? So, because you listen to me talk for 45 minutes to an hour, what I want to do is I'm going to offer all of you a free screen, okay? And so what a free screen is you get to make an appointment, a 30-minute appointment with one of the doctors of physical therapy, and it gives you an opportunity to talk about your specific problems or what's causing your pain, and we will get a game plan together of things or what can be done to get you out of pain, okay, and eliminate the pain for good, okay? Does that sound like a plan? So what I'm going to do is, yeah, oh yeah, we'll go over all that. Does anyone have any questions? Yeah, she was holding up the questions. I'm like, do you have a question? Yes.
Where does scoliosis fit into this whole scheme of things?
Yes, so scoliosis is another one. And so what happens with scoliosis is that's a curvature of the spine. And in some areas of the spine, depending on where the way the curve is, you'll have some stenosis issues because that area is curved and it's closing down that little hole, okay? And also in the other areas, you could have some disc issues because it's kind of pushing the disc out a little bit. So it's a combination of the two. And for scoliosis, it's really patient-specific. A lot of times we're going to have to tighten one side of the spine while loosening the other side of the spine to help correct it a little bit. We're not going to, if it's a significant curvature, we're not going to get you back up, but we reduce a lot of the symptoms and help out with some of those stenosis, some of the disc issues on this side and everything. Yeah. There was a, yes, sir? No.
Yeah, Danny, my question is, with my back pain years ago, when I was working in Silent, and I went to the New England Baptist,
Mm-hmm.
and I saw the doctor, he did the sciatic nerve in the back, and he told me that I would be back to have an operation on my disc,
Yep.
and I told him, I don't think so.
I like that.
But he said, eventually you're gonna have to have it. Well, I've been living with this pain all these years, and I ignore it,
Mm-hmm.
and I just put it out of my mind, but it's there. I know it's there, because when I walk, my knees give out, and I have to sit down with my wife when she's shopping or walking around, I got to sit down because I can't stand it. My thing is, if I had that, and they did they operated, and, what's the word I'm looking for? Where do they put between the spine?
Oh, like a fusion?
A fusion.
Yep.
They put, I was told by people, they put a cement in there,
Yes.
and the hole, and does that cement last for a long time, or just a?
So here's the big thing, and we see this all the time with fusions, okay? So with a fusion, you are making these two segments of the spine, fusing them together, and so that they can't move. So yes, this will never move again. But what happens is, that disc space above it, and disc space below it, those joints above and below, now start to wear down quicker. Because you're still gonna, have to bend down, put your shoes on, or pick something up from the ground, or move over here. So now those joints start to wear down even quicker, and a lot of times you have to have a few, 5 years down the line, you're gonna create pain above it and below it, and start to have a fusion there, or another type of surgery. So that's the big thing.
Thank you.
Yeah. Real quickly though, I'm gonna have, Lisa here is gonna hand out the free screen information.
I'm not the.
So she'll pass them down, you can fill that out, okay? And then we can get scheduled for free screens as I'm answering questions, okay? So, yes.
My understanding with a lot of the stuff I've been reading is the back surgeries are not successful. And more doctors are saying no.
Yeah.
My husband's doctor has said the risk outweighs the rewards of not doing it.
You know you have a good spine doctor when they tell you not to get a spine surgery unless you absolutely have to, unless you've exhausted everything else and you can't live with it. And that's how you know a good spine orthopedic doctor. Because it is true. The success rate for spine surgery is not very favorable. Especially, looking out 2 to 5 years, it's really not favorable. So that's how you know, they really tell you to do everything else before surgery. Did you have another question? Yes, sir.
I was just wondering
So yes, we also do joint manipulations or adjustments as we're trained in that. A lot of our training is for joint manipulations, but we have patients that do go to chiropractors as well. And as long as we know that, that's fine. We work with them. So that's perfectly okay. What I want to do right before I take any more questions, which I'll be here for a little while. We only have we're pretty booked. We have about 4 spots actually this week left. So what I want to do, just to avoid the chaos for Lisa, is I'm just going to name off a time. So I have 4 times here for this week, and then we're kind of looking out after Thanksgiving. And if one of these times works for you, and you'd like to do a free screen, just raise your hand and I'll give it to the first person, okay? So, and this is for a free screen, okay? So tomorrow, Thursday, at 2 p.m. Would anybody want a 2 p.m.? That's your hand went up first, I'm sorry. So I will give that to you. Lisa, you can have that. And then I have a Thursday at 2:30. Did you want the 2:30? Friday, so this Friday at 12:30. Friday at 12:30, okay. And then Friday at 11 a.m. This Friday at 11. Anyone? Okay.
I need to check my phone first.
Yeah.
If I can't do it, I'll give you back.
It's our lifeline right there, these phones. I'm the same way. So, I will be here to answer questions. If you'd like any other times, just talk to Lisa right here. And she has the schedule looking out after Thanksgiving, because next week we're 100% booked already. So we're looking out for after Thanksgiving, okay? So I'll be here to answer any questions. Is there a question up here?
I just want to say.
Oh, real quickly, you guys, 1 second.
I
Go
wanna
stand up.
say- Yes, I do, I want to say, and he's not paid me to say this. I came to a balance seminar here in September 25th. I went to his office and I had that free evaluation. And since then, I've been treated for balance and now for turning my neck. I mean, I was fine if I just would walk around like this, but when I would turn this way or that way, it was very painful. I recommend highly that you go to there for that free screening. It's all paid for, and you will be hooked with this office. I've been treated in hospitals, in New York City. I've been treated over at Wentworth Douglas, but the atmosphere there is second to none. And he's not gonna pay me to say this. There are 7 people there that are the 2 wonderful ladies with whom you interact when you first enter the place. And that's a big thing. That's their position is paramount, because when you go there, you're treated, you really feel special, and then you have the other 5 practitioners but I recommend that you go there. You won't wanna go to any hospital. You'll be hooked.
Thank you very much.
You're welcome.
Appreciate that. Thank you. So, yes, I'll be here for any questions. Yes.
I'll want to
Yeah,
talk to you.
not a problem at all. And, you can talk to Lisa right there, okay?
So what if I made the payment later, can I still get the free consultation?
Yes, yeah, just let us know that you you came to the workshop, and, we'd be more than happy to, get you in, okay? All right. Yes, yeah, actually, here's a card. You are welcome, we got another card.
And I'm gonna ask him about water thoracic I'm gonna go for the evaluation, but I wrote it will be going to Florida January, February, March. Should I wait until I come back? I know, but this is what this is what I'm at. I'd like to go to get the free evaluation now, then for treatment.
Anytime you wanna go, just tell them.
The Niagara goes all the way down to, so. Yep. How long was the surgery?